Lubricants are really helpful following radiotherapy. The reason for that is, as you know, radiotherapy can significantly increase stiffness and dryness over the long term. So lubricants can really help to reduce that friction and just basically help with reducing stiffness and dryness, whether you're using them for yourself or using them as part of sexual activity. Water-based lubricants are lubricants that primarily include water. The reason they're really helpful is because they are quite safe to use with condoms and medical devices. They don't stain substances, they wash off really easily, so they can be really helpful. However, they do dry off quite quickly as well, so often one needs to reapply them. Silicone-based lubricants, they tend to last a little bit longer than water-based lubricants. They stay on skin for a little bit longer. You don't need to reapply them as often. So they're safe to use with condoms as well, and you can also use them in the shower. Silicone-based lubricants can take a little bit longer to wash off. They can often stain fabric, and they're not suitable to use with silicone-based toys. Oil-based lubricants can last a bit longer than water-based lubricants. They also can actually moisturize the tissue quite well as well, so they can be quite helpful for that. Oil-based lubricants, unfortunately, aren't compatible with condoms. They can be a bit harder to clean as well. Often they can stain fabric. Petroleum-based lubricants in particular can slightly increase the risk of infection, so if you're prone to it, we would recommend avoiding it. Natural lubricants can be oil-based or water-based. Again, they're not suitable with condoms, so we'd recommend not using them. There is a lot to think about when it comes to lubricants because of the number of options. Often your clinical team might have some recommendations or products they'd recommend that you use. If you were looking for vaginal use here, we'd recommend a pH of about 3 to 5, because this is close to the vaginal balance. If you were looking for anal use, we would recommend a pH closer to 7, which represents anal balance. There's quite a few products out there that have added chemicals in them. In particular, the ones to think about are parabens, chlorhexidine, and glycerin. All three of these can have unwanted effects on sensitive skin. If you are prone to infections such as thrush or trying to get pregnant, in particular, we would recommend staying away from products that have parabens and glycerin. Products that have spermicide in them can negatively affect sensitive skin. In particular, some lubricants may be labeled as tingling, warming, cooling, or flavored, and they can all have a negative impact on sensitive skin. So we would recommend that you avoid them. There's plenty of products out there. If you're unsure about which type of lubricant to use, we'd recommend that you contact your clinical team and they can probably give you a bit more advice.